Okay, good evening and welcome to the May 28th, 2026 Stanton City Council work session.
Mr. Vice Mayor,
Mr. Overholzer.
I move to approve the work session and regular meeting agendas as presented.
Okay, we have a motion. Is there a second?
Yes, I'll second.
Mayor, would you call the roll?
Ms. Park,
Aye.
Mr. Overholzer,
Aye.
Ms. Woods,
Aye.
Vice Mayor Arrowood.
Aye.
Motion carries.
Moving straight forward, we have the introduction of Xavier Crockett, Director of the Central Shenandoah Health District.
I am pleased to introduce Xavier Crockett. He is recently appointed the director of the Central Shenandoah Health District earlier this year. And he's here tonight to introduce himself, provide an update, and answer any questions you might have.
Good evening, Vice Mayor and council members. First, I want to thank Leslie for the invite. I'm super excited to be here in Staunton and join the Virginia Department of Health. A little bit about me real quick. I've been in healthcare for 15 years. The last 8 years, I've done various leadership positions in public health in Georgia and Colorado. There's probably not a program that I haven't managed in public health, so I've kind of hit the ground running since I've been here. And some of the things that we are very much looking at doing is taking a look at our broader programs and community service activities, as well as getting to know you guys a lot better and understanding what your needs are for the community. Some of the things that in the 5-6 months that I've been here that we are already looking at is chronic disease prevention. We're also looking at expanding services in maternal child health. I've been meeting with the Augusta Health quite a bit over the last few months about those spaces, as well as looking at a lot of the social determinants of health that influence health outcomes like housing and transportation, and looking at those barriers and how we can better facilitate access to services here in our community. I am a native of Atlanta, Georgia, but I did my undergrad here in Danville, Virginia. And I started my career as a health educator actually in rural Southern Virginia. And then I kind of moved around up and down the East Coast working in various spaces, and did a big portion of my career in Atlanta as a a program operations director in Central Georgia. And then I was the state health protection director with all of our state protection programs, and mostly during COVID. So that was a busy time. I've been a health director for the last 2.5 years prior to coming here in Western Colorado. And my wife and I are happy to have moved back to Virginia, where we met and where it kind of all started. So I am very excited to be here, and I've met Leslie several times, and she's been wonderful and getting me acclimated to things around Staunton area. Welcome any questions that you guys have that I could answer.
Right, welcome to the area. Any questions from council?
You mentioned maternal and child health.
Yes, sir.
Is that driven by your analysis of the data and a particular need for attention to that area? Do we lag behind state or national averages in those metrics, or can you explain?
Yeah, so in our initial analysis of data, we are a little higher than state average in several maternal child health indicators. One of the big ones is late or no prenatal care services for our mothers. And so district-wide, we're about 13%. Here in Staunton, we're closer to about 9%. That's still a very high number for the community that we have. And so we're working very closely with our partners in Richmond, as well as our community partners here, to really look at initiatives and programs that we would like to start.
Thank you for that.
Of course.
So, well, welcome.
Thank you.
Welcome, first of all, to the area and back to Virginia. And I know that one of the things that was came from the federal was the community outreach part. Would y'all implement something similar to that? I mean, because that was great for our communities. And when they took the, funding away, it's just like, ooh, everybody was like devastated. So, with something like that, would y'all do it on a smaller scale, not as large as the government granting, funding was, the grant was for that community outreach piece, but would y'all look into something that could be
Yes.
something similar to that?
That's one of my skill sets, I guess I'll say, is building community navigation programs. I built a program like that in Colorado, and I helped start the process down in Georgia. Our community health workers program, it's the future of public health. We know that navigating government and community services programs can be daunting for individuals. And so the plan there is to make sure that we have people on the ground who can help them. Are making sure that people who need access to WIC and Medicaid have somebody that they can talk to. So we do have a program called Connection to Care, and you're correct. We lost most of the workforce for that program. We are currently in a rebuilding phase, and one of the things that we're looking at right now, and there's a lot of conversation on the legislative side, is how do we standardize our community health workers program, as well as how do we be able to bring in some revenue so that that program isn't fluctuating up and down. A lot of states have already put in legislation that allows for billing of community health workers and the work that they do to help keep that program stable.
Well, thank you for that. And
course.
another question, I know at one time the health department used to do like dental and medical. Is that something that y'all still doing, or has
So
that?
prior to COVID, we were doing that. Since COVID, we have not went back to that services, but we are having the conversation with our new state health commissioner about bringing back family planning services and dental services here in some of our regions that a need is for. And so we're doing a lot of data tracking right now and having a lot of conversations with our health community on exactly where they would like us to plug some of the gaps that we see in our community.
Well, along those lines, was there anything in Colorado or Georgia that you were doing that you'd like to bring here that we're not currently doing?
I think the navigation program, I built a program called Grand Valley Connects there that it was a gateway entry program where we were able to build care model teams for housing, food instabilities, transportation barriers, primary care services. And we brought organizations from the community, worked on the same system where everybody would get the same entry intake form, and then we could send out an email to partners saying, these are the needs for this individual who can help. And then we work together as a team to help that individual.
Welcome.
Thank you. Thank you, guys.
Right.
Thank you.
Thank you. Okay, well, moving right along, I believe we have an update from our Valley Community Services Board.
As Dr. Kimberly McClanahan, who's the director of the Valley Community Services Board, is here this evening to provide an update, I imagine, on some pretty significant projects and initiatives they're working on, and to answer questions you might have.
Yeah, absolutely. Oh, there's a PowerPoint.
Okay.
Lovely. It always helps, although I can talk. Thank you for having me back. I think we were here, our finance director was saying, well, weren't we there right before the Harry Potter Festival last year? And in fact, we were, because we got all kinds of goodies that we got to leave with.
Goodies,
So not been that long, but we do have some good updates. And one of the things is that I think, well, when we were here before, we probably had purchased land finally. And we are now working on, it now has a name. Our Crisis Receiving Center is now the Valley Recovery and Assessment Center, or VRAC for short. And it is, as you will recall, 16 chairs for 23-hour observation and 16 beds for ongoing crisis services, generally 3 to 5 days, although it could be a bit more than that. But we're hoping that we will be.
There's a button right on the side of the.
A button. button
On the side of your clicker.
here?
Yep.
Okay, that's not working. Why am I not? Okay, I guess I'm not smart enough to do this.
It's a tricky creature. It's
Oh, all I had to do was turn it on. Amazing. Okay, so we ended up actually buying the very first property we ever looked at. When we went to buy it the first time, the property owners decided not to sell it to us. Don't know why. Don't know why they decided to 2 years later. But it is lovely property, 6.17 acres, and we'll show you some pictures of it here in a minute. But it will be, as we said, a crisis receiving, stabilization, and detoxification unit. And it will be 24 hours a day, 7 days a week, full service. And it is close to the hospital, which is really good because if we need to have people there, they're medically frail or fragile or whatever, and we need to transport them or they need to transport from the hospital, it's about a mile away, actually. So it's really right off of Wilson Boulevard, Tinkling Springs, and then Wilson Boulevard, very close to the hospital. We've met with a lot of the officials who have to give us the go-ahead in Augusta County. And also, one of the things that I was really worried about, because if you have followed the papers at all, you know that it's been a struggle for us to get this property at all. And the property owners actually had a covenant on the property that they kind of got final say in what it would look like. So you're always a little worried about that. And we'd had some struggles on a prior property that we thought we were going to buy. So it was really good when we met with these folks and they said, yes, this is okay. So it is there and now, did I do something?
No, that's on the
Okay.
side.
It has, we'll have about 100 parking spaces. I'll show you some actual pictures of what we think it's going to look like. Fenced-in exercise facilities, obviously an emergency access lane, and all the good stuff. And this is, shoot. This is a rendering of it. The pinky, orangey, red things you see on the top are HVAC units that you won't be able to see from the ground. And then that is what we think it's going to look like at the end of the day. And this is what the property owner said, okay, we like that. And so do we. So one side will actually be, well, it goes back, but one side will have the chairs for the 23-hour observation. The other side will have the beds. And then there will be a connecting area in the middle that will be a nursing medical station where folks can go either direction and helping out. So
How long?
go ahead.
I'm sorry.
No worries.
How long would a person be able to stay there? What's the turnaround? Is it?
Well, now the 23-hour observation is literally you must do something after 23 hours and 59 minutes. So you either go home, you step up to the stabilization unit, or if you're really in bad shape, you might need to go to the hospital. The crisis stay unit and detox unit is on an average 3 to 5 days, but you can get up to 15 days stay if it's really needed.
Okay. So all of that is built into all three things is built into this.
Yes.
So it's I'm
No,
I'm
that's
not
okay.
asking questions, but it's just that I'm looking at the building. It really looks good. The property really looks good. Is it because I saw that you had the exercise, and that's why I was asking the
Mhm.
question about how long does somebody get to stay,
Yeah.
if they need to.
Yeah.
So you have two tiers. So you have the 24 hour
20, it's 23
and 59.
and 59 minutes, yes. It's
For
a
that.
Medicaid regulation. Don't ask me. It's above my pay grade, for sure. But yes, so somebody can come in crisis, and in many cases, the research will show that they will de-escalate enough to be able to release back to their home within that 24-hour period. But then you have right across the hall the ability to step up to a crisis stay unit or detox unit for several days.
Well, thank you.
Oh, you're welcome. This is an updated project budget. So it's right at $20 million dollars, and you can see that the majority of it is actually being paid for by our partners at the state, the Department of Behavioral Health and Developmental Services. So about 80% is being paid for by them. And then well, not we, but our board of directors, the Valley Board of Directors set aside 1.5 million a couple of years ago towards the project, which is waiting to be spent. And then your locality funds are actually spread out over a couple of years there. And by the way, let me thank you very much for approving the 10%. It's so helpful that you do that. Really, really appreciate it a lot. And then obviously we have a great finance director. He can make that the same number at both sides of that, just like a balance sheet. Let me tell you a little bit, that's just a different way of looking at it. And then the timeline, obviously we have the site. We're 95% into the design in terms of the architectural design. We hope that we're going to break ground in August. First, a little bit that will depend on how much rock there is under the soil. But you know, building projects. If all goes well, we hope to not open the doors, but have the project completed by January of 2028. And then we have to get licensed and all that kind of good stuff. But again, weather, rock. We'll hope for good weather and no rock. And this just a reminder of all the people who have had, all the entities that have had a part in this very long and arduous process. So can't tell you how excited I am to be at a different place with it, moving forward finally. And I thought I would bring you up to date on a few other things tonight, since we are actually making progress on the VRAC. And what you're seeing here, or about to see, this is a home here in Staunton on First Street that we've owned for many years. And other people have owned it. It's been a church. It's been a regular residence. It was a day program for us for many years. And we've just renovated it. And the reason we renovated it is that we actually have two intermediate care facilities, or ICFs, for people with intellectual and developmental disabilities. And both of those facilities or homes hold 6 people. We own one of them called Grandview. It's in Waynesboro. We leased another one in Waynesboro called Greenstone for many years, since the 80s. And it was a very large industrial size and industrial looking building, not very homey at all. And we didn't own it, and we spent a ton of money on it. And the building was falling apart, and the owners really didn't do much to change that. So pretty much the first day I walked in the door 5.5 years ago, our developmental services director said, we've really got to get out of that building. We need to do something different. And so 5.5 years later, we actually have 6 people in the building, and they love it. It's all ADA compliant. And it had renovation projects, I think, might even be worse than building from the ground up, because it had its struggles for sure. But there it is. And there's a canopy there that will allow for a big van to come in, with a handicap van, and let our folks off, not get in the inclement weather. And then the really cool part is from our front porch. This is one of the neighbors, and what he actually took a picture of that sunset. So that's a pretty cool way to end your day, I think. I thought I'd also give you a little bit of a financial update from our Director of Finance, and we're on solid ground there. Again, I don't know how many of you were around 6 years ago, but at that point, things were not in good shape. So the powers that be in accounting, GFOA and ICMA, again, above my pay grade, do these different metrics that show how healthy you are. And an 84 out of 100 is pretty good. Overall finances are solid. Revenue is below the plan, but so are expenses. So we're always working on revenue. And we also, our main source of revenue is Medicaid. So we could get into a whole discussion about what's coming up with Medicaid, but we won't. We know it, and we're working on it with the folks who are going to be affected by it. I'll say that much. But we are doing well. And we have about 25, I don't know if it's in there, about 25 million in the bank. Now, let me say, seems like a lot of money to me. A lot of that is restricted money that the state says you can only use for this. And if you don't use it for this, then we either want it back or you just got to wait around until, so we just got this, finally in writing, an Exhibit D for 9.6 million from DBHDS for the project, the VRAC. And it has to be used for that. I mean, we cannot use it for anything else. We're excited as heck to have it, but that just gives you an example of, yeah, there's money there, but a lot of it has to be used in certain ways. So, so we are looking good. We're watching the revenue, trying to figure out, what I don't know that we're doing anything wrong, but we have to watch it. And particularly with the Medicaid cuts, potential cuts coming up, it'll be even more. So just kind of the federal government with HR 1, again, economic uncertainty all around, as we all know. We don't have a state budget yet, as you know. And so we don't know exactly how that could possibly impact us as well. But the good news is we are doing okay. And then that's just some things about the proposed budget. And yeah, we will hopefully do a state supported, and the news now is it's a 2% cost of living. So I'm not sure, but we have our budget out there to our board and they'll approve it this next month. We also, in one of the tasks I was given kind of on my way in the door, was to come up with a 501c3. So Valley Community Outreach is our 501c3. If you know a lot of rich people and they want to write a check, we could use it. So we were established finally back in November of 2024. As our finance director says, we're still in the 20th century with this because we can only accept checks, but we are willing to accept checks. And then, of course, that board has its own directors as well. 3 donation categories where you can, the VCO board would decide how and when to use, and then the VCSB general, which would be, apparently I would decide, and then the VCSB program or department. So you can actually write a check and say, I want this to be used for developmental disability services, or I want this to be used for substance use services, which I think is pretty cool. And people will sometimes do that. Or I want this used for the VRAC, which we could use that too. So that's just some information about that. We're not very flush at this point. We actually had a $10,000 donation from First Bank and Trust when we were first going out for it. So that's most of the money. But we are willing to see those lines increase. And I thought you might be interested as well, and I will be brief, I'm almost done. Our latest employee satisfaction survey results, we did an employee satisfaction survey 2 or 3 years ago. We just did this one in the past year. And we actually had 72% of our employees participated, which if you know anything about survey return rates, that is amazingly good. So we're pretty excited that we had such a broad representation. And in terms of their overall engagement, our favorable scores in comparison to the industry average were a bit better. We had 77% favorable engagement and the industry average was 73%. So we're pretty happy about that. And then, and I can't read that, so I got to read this. We're pretty proud too of the item details about being proud to work for us, 84%, as opposed to 81% for the industry. Recommending the company as a place to work, 83%, as opposed to 75% for the industry. Satisfied with the company, 80% as opposed to 75%. And everybody thinks about changing jobs all the time, right? So, but we still beat the industry average by a percentage point, but 61 as opposed to 60. And then, of course, on all but 2 of these, we also did better than the industry average. The 2 that we didn't do as well on, I believe this company has an outstanding future, and average was 77% for the industry, 74% for us. And then I trust the senior leadership of this company. And we were at 60% and the average for overall was 69%. You may or may not recall, keep hoping our long-term employees quit recalling. But again, 6, 7 years ago, things were not only bad financially, there was a lot of layoffs that were just kind of, it's Friday afternoon, goodbye sort of thing. So there, with long-term employees who are still there, some still carry that trauma with them. And some people you never make happy. And that's okay. I mean, we're clearly not perfect, but I wanted you to know that I think we're doing pretty well. And I'm not going to read all these, but our HR director just kind of put these in 3 categories: highest positive responses, the most neutral responses, and those are kind of like, I don't care one way or the other. And of course, you've got your negative responses as well. So I just wanted to kind of give you an update on a few things, not just, I know we've been in here talking about that crisis receiving center for 2 years. I thought you might want to hear a little bit about something else. So I am happy to answer any questions or act like I can.
Well, great. Thank you for the update. It sounds like you're getting things in line. A lot of uncertainty as usual, financially.
Yeah, oh yeah, absolutely.
Good to see the 501c3 getting off the ground too. That's
Yeah, they, Valley had one many years ago, and there's a whole long story about how that got out of their control. But this one is set up so that it will never get out of Valley's pocket, so to speak.
Sure.
Now, last week, I am told that you all were sent one of our annual reports. I know the mail may be bad, and Leslie, if they don't get them,
I don't know.
but
Did
I
you
got
get
on my
one?
desk.
Oh, you got one on your desk? Okay.
Right here.
You
Somebody
guys have
did?
them on your
Yes.
desk?
Just tell us.
Dallas, we'll figure out what happened. Yeah, I don't know.
but if
don't
you
remember
let me
seeing it.
know, we
Yeah.
can send some out, hard copies or electronic copies, but
Okay, we'll try, we'll look for them.
okay.
Yeah.
Sounds good. Any other questions?
Questions from council?
The new charitable arm, is that, are the particular purposes that are earmarked for that, or is it just intended to be mostly a supplementary form of income for the entire operation? Of course, depending on whether people earmark, but
Right.
for the
It-
general,
Yes, it is both. I mean, it is to support Valley Community Services Board. That is its entire purpose. So it is a supporting organization in that sense. And then as far as what can be donated, it can be earmarked for whatever or for general purposes.
you have particular hopes or goals for that?
Well, yes, there was one particularly for the Crisis Receiving Center. We're hoping to actually raise $250,000. So, and I know that our manager of the Crisis Receiving Center, Dustin Wright, has been out to various and sundry community meetings, the Rotary in different places. So, but we're hoping to have that, but not banking on it. But that is one thing that we really did hope that we might come up with in the next bid.
Specifically for the crisis receiving center?
Yes, the VRAC.
Yep.
But I think it would, the check, yes, that would be your line item, your description on a piece of paper on the bottom of the check. Anything else? All right.
That was my question also, so he beat me to it.
Okay. Well, thank you so much for having me, and thank you so much for all that you do for the community.
Thank you. It
Thank
sounds like a
you.
great facility. Okay. Next item is a closed meeting for discussion or consideration of the acquisition of real property for a public purpose located on Churchill Avenue, which also includes our break until the regular meeting.
Vice Mayor Arrowwood. Okay, I move to enter a closed meeting for the discussion of consideration of the acquisition of real property located on Churchill Avenue for a public purpose where discussion in an open meeting would adversely affect the bargaining position or negotiation strategy of the public body pursuant to Virginia Code 2.2-371183.
I'll second.
All right, motion and a second. Blair, would you call the roll?
Ms. Park,
Aye.
Mr. Overholtzer,
Aye.
Ms. Woods,
Aye.
Vice Mayor Arrowwood.
Aye. And with that,
Motion carries.
we are in closed session. Is there a motion to come out of closed session?
Yes. I move that council reconvene in an open meeting and certify to the best of each member's knowledge that only lawfully exempted public business matters were discussed and that only public business matters are identified in the closed meeting motion we are heard, discussed, or considered in the meeting.
I'll second.
Thank you. Mr. Blair, would you call the roll?
Yes. Ms. Park,
Aye.
Mr. Overholzer,
Aye.
Ms. Woods,
Aye.
Vice Mayor Arrowood.
Aye.
Motion carries.
Okay, we have left closed session. Now I'd like to go ahead and call a regular meeting for Stanton City Council for May 28th, 2026 to order. We will start with the Pledge of Allegiance. Please stand and join us as you're able. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, now, this evening's invocation or moment of silence is brought to us by Councilmember Overholzer.
And in just a minute, I will call to the podium Pastor Elaine Rose. I wanted to say something about her organization first. She is president of Building Bridges for the Greater Good, an organization that I think exemplifies constructive civic engagement, something we really need now. They are really superb at, through discussion, education, and advocacy, tackling sometimes contentious issues in a spirit of love, grace, and problem solving. They have a Breaking Bread series, usually at the Booker T. Washington Community Center. They've had topics like the impact of urban renewal, what we lost, the businesses, Black businesses and homes in the downtown district that were lost because of that movement, food insecurity. They've sponsored discussions about homelessness, affordable housing, many other topics, organized forums on political candidates. They collect foods, toiletries, other items to provide for the most vulnerable in our area. So I just really applaud them and appreciate them and their very able leader, Pastor Elaine Rose, who will now bring us the invocation. Thank you, Pastor Rose.
Good evening.
Good evening.
Good evening.
Let us pray. Kind and most holy God, we humbly bow before you. Your word says that the earth is the Lord's and the fullness thereof, and they that dwell therein. And so, God, we ask tonight that you would bestow upon the city council wisdom, knowledge, and understanding, and a desire to do what is right for your people. We ask, oh holy God, that you would come into this city and break things that don't belong. And God, we know we can't do anything until you move. So we pray for the homeless, for the sick and the shut in, for everybody, God, that is out there. And we ask, God, that you would have your way in the city of Staunton, Virginia. And most of all, God, give our city council people the boldness and the courageousness to make a decision according to your will and not things that are outside of your will. Have your way, God. In Jesus' name we pray. Amen.
Thank you.
Okay. It's not fair to bring in a ringer, Jeff. Thank you, as always. Wonderful. I love all the stuff that you're involved in, been just such a huge part of things with building bridges. Thank you for coming. All right, we get to move on to a proclamation that we get to do each year, and I'm happy to see so many people here in the audience for it. Let's see, let me go ahead and read this for you. This is a proclamation for LGBTQ plus Pride Month and the Shenandoah LGBTQ Center. Whereas our nation was founded on the principle of equal rights for all people, but the fulfillment of this promise has been long in coming for many Americans. And whereas the historical riot at Stonewall in New York City on June 28, 1969 is recognized as the beginning of the modern-day LGBTQ plus civil rights movement, and as a result, June has been celebrated as LGBTQ plus Pride Month nationwide for over 50 years. And whereas everyone should be able to live without fear of prejudice, discrimination, violence, and hatred based on race, ethnicity, religion, class, gender identity, sexual orientation, age, mental or physical disability, and whereas the fabric of our community is strengthened when we center the values of equity, justice, diversity, acceptance, inclusion, and kindness, not only during this month of recognition, but throughout the year. And whereas Staunton has a diverse LGBTQ plus community and is committed to uplifting the voices and dignity for all people in the community. And whereas the Shenandoah LGBTQ Center of Staunton, Virginia was established in July 2018 by Christopher Wood to address the unique challenges faced by the rural LGBTQ plus community, strengthening it through advocacy, education programs, and safe spaces. And whereas consistent with the efforts of the center, the city of Staunton strives to be a community where everyone is celebrated for our differences rather than limited by what might divide us. Now, therefore, be it proclaimed by Staunton City Council that the month of June 2026 is hereby designated as LGBTQ plus Pride Month in the city of Staunton. And council honors the Shenandoah LGBTQ Center and their work to serve the LGBTQ plus community, encourages the citizens of Staunton to celebrate our diverse community and join in celebrating the resiliency of the LGBTQ plus people of all ages. Do we have a representative to come? Is there anyone? Yeah, please. will you
Yes.
Come up and.
Good evening, everyone. Can folks hear me? Yes? Okay. Vice Mayor, Vice Mayor Arrowood, thank you so much. City Council members and all who are present here tonight. It is with deep gratitude and pride that I accept this proclamation on behalf of the Shenandoah LGBTQ Center. Please accept our appreciation for this recognition of a month that is so important to many of us in the community. This year, it felt particularly important to receive this recognition in a meaningful way. I've invited our community here to share in the acceptance of this proclamation. It belongs to them. I see it as a powerful acknowledgement of the many ways that our LGBTQ community contributes meaningfully to life here in Staunton. As leaders, business owners, parents, artists, educators, organizers, caregivers, philanthropists, and everyone in between. I am so grateful to be in community with everyone here. They add so much richness to my life here in Staunton. As I think about their stories and of the folks served by the center and those unable to attend tonight, I am reminded that for many of us, safety isn't always certain, and acceptance has often come at a grave cost. You don't have to go far these days, a social media comment section, my own email inbox, to see the hate that our community continues to endure. Some here, our trans community, cannot receive a passport that reflects who they are, cannot serve in the military, cannot access services and resources that honor them. Many others here have marriages that our own state constitution still contains language to deny. A ban that will only now be corrected, hopefully, by Virginia voters this year in 2026. Moments like this matter. Change can and should happen here in this room together as neighbors. Please carry this forward in action to continue to make this city more just and more welcoming for us all. Thank you for your commitment to our community, to our visibility. I am proud to live here and to call Staunton home. Thank you.
Come up for a picture.
Could I invite folks? If there's anyone who would like to photo, I would encourage, please come join us.
Not even. No,
You take the photo.
I'm the reporter.
All right, 1, 2. Thank you.
Thank you so much.
Okay. Moving on to the Vice Mayor's report this evening. Feels like we're getting into summertime here, and this week is always famously for parents the week with no childcare before all of the camps start and any of the activities. And I'm definitely no different. It feels like the endless weekend in its own way. But I'm along those lines. This council I was very pleased that we were able to move forward with the Camp Staunton and keeping that probably the lowest cost camp option, and I think the greatest one as well too with that. And we were able to make that first open to Staunton residents to for the first 2 weeks, it's only open to Staunton residents as its official city program on that, so that we could help with that continuing crisis. And the Community Foundation is starting a This is Childcare documentary that they're working on, and a report on that as well too, because it's just such a huge ongoing crisis to find places to do it so people can actually get to work. So it's great to be part of helping with that in a way that we actually can. So what else from council members? Do you have other exciting things to report?
But one small item, I feel like if Councilor Campbell were here, he would want to plug the session June 3rd, the joint meeting of City Council and the Comprehensive Plan Committee, that this is drawing to a close, the comprehensive plan. It is a blueprint for our community, and we've had many community listening sessions, some online input. Opportunity for that has just closed, but there's still a chance to have some influence, to have a say, to make it reflect your needs and your priorities, what's important to you. So we just encourage people to come to that if they can, June 3rd, 6 p.m. at the library, and read it online. All of it's available online, and you can use the form or the email to send comments.
I would like to point out one thing I forgot. Tomorrow at Leslie, 10 a.m., the pool house opening.
Yes. What day is today? Yes, tomorrow. Sorry, I think for a minute.
Yeah,
Yes.
and that'll be the beginning of the opening of the pool for the season.
Well, the
as
pool has
too.
been open, but we had to delay the ribbon cutting because we couldn't open the pool
That's
that
true. We
day.
couldn't, yeah.
So tomorrow at 10 o'clock is the official
It's
ribbon cutting.
official. So yeah, if you
please
want to
come
come
by.
see the new building
I think we have
officially,
food
which-
and
yeah.
treats, right? Okay, so come get a freezy pop, I think.
Yeah.
So 10 o'clock tomorrow. Yes.
One last thing on that too. So, okay. Councilor Woods, do you have?
Yes, if there's nobody,
Yeah,
no
yeah.
one else. Okay, so out of the nominations committee, I'd like to move that the Stanton City Council make the following appointment to appoint Mark Andros to the Library Advisory Board for a 3-year term commencing June 1st, 2026 and ending May 31st, 2020.
Okay, we have a motion. Mr. Blair, would you call the roll?
Sure. Ms. Woods,
Aye.
Mr. Overholtzer,
Aye.
Ms. Park,
Aye.
Vice Mayor Arrowood.
Aye.
Motion carries.
Okay. We can move on to item A, our consent agenda. We regularly move items that are non-controversial onto our consent agenda. Does any council member, would any council member like to remove any item for the consent agenda? Okay. Motion.
Mr. Mayor, Mr. Vice Mayor, I move to adopt the consent agenda as presented.
Second.
Motion and a second. Mr. Blair?
Ms. Woods,
Aye.
Mr. Overholtzer,
Aye.
Ms. Park,
Aye.
Vice Mayor Arrowood.
Aye.
Motion carries.
On to item B, we have a public hearing for an ordinance to amend the FY 2026 budget ordinance for the city of Staunton by adding budget amendment number 3.
Jesse Moyers, our Chief Finance Officer, is here this evening, and there is no motion required. This is just a public consideration will be at your June.
Thank you, Ms. Moyers.
Good evening, Vice Mayor Arrowood, members council. I'm before you this evening with the third and final budget amendment for FY 2026. The amendment totals almost $1.8 million between both the city and the schools. The city portion of the amendment is $766,799, and the school amendment is a little over $1 million. The school board approved their amendment on May 11th at the school board meeting. The public hearing was properly advertised on May 20th and will be held shortly after my introduction. And then it will come back to you for a vote on June 25th. The general fund portion of this is $88,158, made up of recovery cost of $5,478, which is insurance recovery, $720 for sheriff's department, $3,137 for fire department, and $1,621 for Parks and Rec. There's $82,680 for grants and contributions. The largest portion of that is public safety. The Student Resource Officer grant for $57,297. National Highway Traffic Safety Grant, $15,600. And the Versa Safety Grant of $2,600. Public Works, $6,000 for the Virginia Walkability Action Institute grant, and the Kiwanis reimbursement of $1,183. The bond fund appropriation totals $28,856, and that is just interest earned on our funds in that, or on funds sitting in that fund. Grant fund is $1,900, and that's the DCJS grant. And then HUD appropriation is $624,646. $55,000 of that is our transfer from the general fund. $63,559 for grant admin. $5,049 for CVHD1. 2023 HUD is $34,221. 2024 HUD is $212,579. And 2025 HUD funds is $254,238. Blue Ridge Court Services has an additional appropriation of $9,976 for the DCJS grant revenue. And then the environmental fund, there's an insurance recovery there of $13,263. Moving on to the school portion of the amendment. Education fund is the largest portion of $939,892. They received a TEAS grant, Targeted Extended Enriched School Year, of $400,000. They received 2 additional targeted school improvement grants, one for Ware, one for Shelburne, $45,150 each. They received additional state money to pay out a bonus. That revenue is $264,653. The appropriation for the local share of that bonus payment is $180,946. Their share of the Versa grant is $3,820, and they had a small insurance recovery of $173. The school CIP fund, they earned $65,000 of interest on their CIP reserves, which will be using toward an additional school bus. Are there any questions? And like Leslie said, there will be no vote tonight. So if you think of a question between now and when we do take the vote in June, you're welcome to call me, email me, or come see me.
Ms. Moore, it's probably more of a school board question, but the TEAS grant, do you have a general overview of what that them to do? Lets them do.
Let me see. Looks like the majority of it is for middle school. So it's, you're going to be used at Shelburne. They'll be buying a vehicle. A little over 81,000 will be used on educational supplies. And then grant purchase services. I can get you more detail.
Okay,
Of the breakdown of that.
great. I'm glad to hear they got it. So, okay, any other questions from council?
Is there anything unexpected here? Grants that weren't anticipated, weren't planned for, weren't budgeted for?
Not really. A lot of these are our annual, some of these are annual grants that we get every year. And we don't appropriate them until we actually receive them.
That's why we need the budget.
Mhm.
Probably seems odd to the public.
Yeah. Most of this is normal housekeeping stuff.
Can you explain why there are 3 different years for the HUD appropriations? Is that unspent balances?
Unspent funds from those particular years, yes.
And so it has to be reappropriated?
Reappropriate it in order to spend it because it's not a multi-year fund like our CIP. If you don't spend it in that year, we must bring it back and reappropriate. All right. If there's no additional questions, you can move on to public hearing and I will stick around and
Okay. Go ahead and open the public hearing for this item and for this item only, for the ordinance to amend the budget. And we'll alternate between people on online and zooming in on this one and people in the audience. Public hearing is now open. Would anyone like to come? Oh. Welcome.
Good evening, Aaron Burmer, Staunton, Virginia. I had a question for the finance director about the CIP interest. I would have a follow-up question for you perhaps after the meeting. Thank you.
Knight, is there anyone with their hand raised?
Yes, we have one hand raised. Go ahead, caller.
Oh, hi. I just wanted to know, I don't know what CIP stands for.
Capital Improvement Program.
Okay, thank you.
Okay. Anyone else from the audience like to speak about this matter? No. Okay. Any other hands raised?
We have no other hands raised.
Okay, well, I will go ahead and close this public hearing. No vote is required on this, so we can move on to the next item. Now, next item is the item C, consideration of an application for staffing for adequate fire and emergency response grants.
Yes, Fire Chief Jason Ball is here this evening to present this item and answer any questions.
Good evening, Vice Mayor Airwood, members of council. I come before you tonight to get permission to apply for the 2026 SAFER grant application. Majority of the slides you may recall from last year. Thanks to Jesse for going through and updating all the numbers that were needed. Last year I asked to apply for 3. We went with. I'm sorry, I asked to apply for 6. We went with 3. Unfortunately, we did not get that. There were 6 departments in the state that got it, the largest of which being Loudoun County, getting nearly $4 million. But we'll get through that. So we would like to apply again. The commitment that council made FY27 with the enhanced multiplier was just, we thank you again for that. Recruitment and retention, we're going to use that. I'm proud to say that we're the first in the Saw area that did receive it. So I look for the other localities to move forward with it as well. So just thank you for that again. So the grant, the first year, the grant funds 75% of the cost of the salaries. The first year you'll see is a little higher than year number 2. Jesse built in about $20,000 for uniforms and gear cost just on that initial year. If you want to scroll on down. So current staffing, 36. There's 3 admin positions or 11 per shift. The grant would allow 1 additional person per shift. The safer incidents, by having more people there, we in 2024, when I took over as interim, we had to make a staffing decision. We were at 11 per shift with a minimum of 11. So we had to have a part-time person work in order for one of our full-time people to be off. It wasn't working. So we made the decision to drop our staff to 10 because morale was just circling. They couldn't get off their earned leave. They could plan a vacation for the following year, and they were not guaranteed to be off. So we made the decision to drop to 10. So this grant will allow us to make the minimum back to 11, increase the paid parental leave coverage, general leave, FY 25. We had $13,000 in coverage for just paid parental leave. That doesn't count the vacation time, the sick call-ins. You want to raise on up there? So the big numbers, so the first year, FY 27, is the 96,000, so the 75%. Again, this is when you see the next slide for the second year, it will drop about 15 or so thousand to 87,000 because the budget we will have in our budget, in our uniform budget, enough to cover the cost of additional uniforms, t-shirts, pants, shorts throughout the year. And then the third year, it goes to 35%. So the city would have to fund 196,603 in order to maintain those positions. Now, if we get the grant and we do accept, applying for the grant and getting it's one thing, but then we will have to come back. You all had to agree to accept the grant. Once you accept the grant, we must keep those folks for a minimum of 3 years. After that, after the 3 years, it's up to you all whether we're going to keep them or not, but we must keep them for 3 years. So at the end of the grant, $293,550 that will maintain, we would have to maintain that for the next 3 years. Obviously with cost of living increases and such, that number will be a little higher, but that's your about 300,000 for the next 3 years to keep the 3 positions that we got the grant for. Josh, what you got? Oh, and that's it. It was pretty, Jesse, thank you for everything. I'm sure Jesse will answer any questions on numbers that anyone has. She put it all together. We had to do it pretty quick. It come out Tuesday. We had to have it on the agenda by Friday because of the council meeting schedule. So you'll give Jesse.
Any questions from council?
Yeah, no question is a dumb question, right? So it says the NF, so that's National Firefighters. What is the NFPA?
National Firefighters Protection Association.
Association, okay.
Correct.
So it says they're standing on so this would help get to that level that they require. So how many firefighters do they require?
Let's see, it is 15 on a fire within the first 8 minutes. So you'll see that we'll have 11 per shift. So that 11 plus one of our admin people, plus we're able to count Company 10 staff, the one in front of Walmart, as part of our initial response. Because we changed some responses. Anytime that there's a call that comes in, they tell dispatch there's a confirmed fire, Company 10, or the station in front of Walmart automatically goes with us. And they have a minimum of 3 per day. So 14 plus one of us would put us right at 15.
At 15.
Mm.
Okay, so with the other 3 that you're talking, the grant that covers these 3, so one of those would be able to help raise it up to the 15?
Yes, we would put that would make our minimum on shift 11. Currently it's 10, so our minimum shift personnel would be 11. And then we count one of either Brian, Adam, or I, 12, and then the 4 from the county should get us right at that mark.
So is that required does that make, I know bigger cities require more, but is that a standard for what size city and what size firehouse?
That is a standard with a ladder truck. So it drops to like 12 or 13 if you do not have a ladder truck. But they know the ladder truck's going to be intense work, so it requires more people. That's why it's up to 15. But it also helps on the ISO. ISO, so everyone's home insurance cost or premium is based off of ISO. We have our ISO review coming up. It should be this year. We haven't heard from them. But the lower our ISO number, the better your insurance premiums are. So the more staffing that we have, it looks better for ISO. We're at a 2 now, and 1's the best. So we're hoping we'll maintain the 2. There's, they look at all kinds of stuff from infrastructure to 911 calls, but that's coming. So we feel certain we'll maintain the 2 and we'll aim for the 1.
Yeah, sort of along those lines, I was wondering about how, with the particularities of the Virginia system with city, not county, and county, not city. Often it's blend of county and city on any larger event, and
It
it's
is.
fire, there. So, I mean, does that number you're counting responders from the county as well in that, it sounds like?
We're able to count them because they're in the city.
Oh, just them?
Yeah.
So if
So-
anybody flexes over to help out, that doesn't count?
That's really not automatic aid. We have mutual aid in place. So if we get there and say second alarm, then agencies from the county come in mutual aid. If there's a fire, they're considered automatic aid because they're coming, when we're dispatched, they're dispatched. Mutual aid, we get there and call for them. They're going to have to call the county and dispatch them. So it's considered mutual aid because they weren't on the initial call with us. We called and requested them.
But you
Did that
spend
help
more
at all?
time fighting the fire than counting each other, I suppose. That too. But okay, that's
Did that clear up anything?
think about it later. All right. Any
Can you
more
say anything more
questions?
about what the basis for this standard, the agency that Councilor Woods asked about, that standard that we're trying to get up to, which is what, 17 responders in the first 18 minutes? Did I get that right?
Yes.
How did
No,
they-
in the first, it was 18. I've got notes everywhere.
Yeah, 17 personnel.
17 in the first 8 minutes.
Yeah, that's what I said. So what is their basis for?
So they set standards for everything from our breathing apparatus to the apparatus that we purchase. They set standards. Look, you have to have this in order to meet our standard. From the gloves to boots, helmets. They set the standards for everything in the fire service.
Question is just the why, but I guess that gets very technical.
That is a committee. There's a committee for everything. So when they meet, they look at it and say, well, you need this fitting. I think we need this fitting to make things safer. So they put it out in their next standard, the 5th year, and then it's up to everyone to fund it to assure they're in NFPA compliance.
Any further questions?
I guess I'm wondering, we probably knew we were going to make this request that this year. We knew since the failed attempt last year that we'd be wanting to make when did we get notified about that we didn't get the grant for?
That was September. Does
Okay.
it sound right?
Fall, early fall.
I'm pretty sure it was September. But then this has been delayed. DHS was shut down for 76 days. So those funds we did not know about, and then it opened up Tuesday.
But essentially, it's a budget request. I'm wondering why this wasn't teed up as part of our budget deliberations. I know the big ask is for long-term, for 4 years from now, when the $300,000 obligation hits. But I just would have liked to sort of see it together with the other budget request to understand the total.
Okay. We did not know that it was not 100% that it was even going to be available, but we will.
Okay.
Yeah, I will
Make
go
that
ahead.
note.
I appreciate that you guys moved on it so quick and picking up Tuesday to hear that's really great. So I would make the move. I move that City Council authorizes staff to apply for the staffing for adequate fire and emergency response grant.
Okay, we have motions. There a second?
I'll second.
Councilor Woods, Mr. Blair, would you call the roll, please?
Do we have an opportunity to
So
discuss?
we'll actually, yeah, okay. Is there any further discussion? Yeah.
I just, I don't want to turn down free money, and I think it has merit to bring us up to the standards, as you point out. It has a potential impact for our homeowners to bring down their insurance rates. So there are a lot of benefits and a lot of good that could come from this. In addition, I appreciate that this would bring about 460,000 plus in federal money to help us do something that we probably should want to do anyway. I want to make sure that people understand that we're on the hook for the fourth year for about $300,000, which is explicitly noted in the request is that we have not identified a funding source for that. And the 300,000 is equivalent to about a penny in property tax rate. So just awareness note, on balance, as I think this through, it concerns me that we haven't worked out what is the funding source. But to help us with the transition, the federal money to help us get there, and of course, that's not guaranteed, but it's a good initiative to apply for this. And it's the right thing to do, and it'll put us in a good place, not only in terms of safety requirements, keeping our residents safe, but providing some benefit for the home insurance rates too. So that's kind of my thought process, trying to be transparent about this.
Certainly. And along those lines, we're a growing city, with new parts of the city building up too. So we definitely need higher staffing and that we have the ladder truck as well, and that too. So I agree. It helps us to ease into a larger staff on this.
So my question is, with the three, if somebody retires, how would the three new staff, could somebody be hired out of the three? And then would you have to bring it back up to three?
So I think that would, Jesse, correct me if I'm wrong. I think once those three positions are deemed safer, then they're exempt. They cannot be hired full-time till after the 3-year period. Does that sound right, Jesse? They will be earmarked safer personnel. So we would have to hire someone at the base salary.
Yes, it would just be a grant funded position that we would eventually, once we pass the 3 years after is it year 7? We have to keep them through year 7. After that, you can make the decision to reduce staffing, or they just become a fully funded city staff. And we have identified the funding for FY27 that would come out of the FY25 carryover that was not appropriated during FY26. We had about 400 and some thousand left there. So that is the funding source for FY27. Going into FY28's budget, we'll have to identify, I believe it's 75,000 was the number that we will have to identify in the FY28 budget, and then 29, 20, and 30. But 27 would be covered with FY25 carryover.
Did that answer your question? So we would have to hire somebody, like we have a vacancy right now. We would have to advertise and bring them in. We could not hire one of the deemed safer positions until after the 6-year period.
So if you choose to reduce the staff after the 4th year, the staff could be reduced. We wouldn't have to hire those 3 in, as you were just stating, that we would be on the hook for 3 staff, but that doesn't necessarily mean that we have to after the 4th year, right? Because we have to find. So after year 4,
Okay.
that's the end of the grant.
We have to keep them for an additional 3 years.
7 years.
Oh, so it's 7 years. So that's what I wasn't
Yeah,
understanding.
the grant only covers 3, and then we have to keep them an additional 3, a minimum.
Got you. So that is what I wasn't understanding.
Okay, I
So
thought you were
the-
speaking of a retirement.
Is that
No,
correct?
so
Mr.
the
Blair?
grant only
I don't know.
covers the first 3. So this is 7 years, period, right?
Yes.
Okay, got you.
The last time fire added positions was through a safer grant, because when I came here, that was kind of wrapping up, and those were not scaled back. I mean, those positions are in the budget now.
Okay.
So just as a point of reference.
That was 6.
And that was 6 positions.
Right, okay. So I wasn't understanding how many years that this grant covered was just the 3, but they're safe for 7. They're safe for 7 years.
Correct.
So that means, okay.
But we're
gotcha.
paying for the last
We're paying for the
several
last
years.
3, yeah. Okay,
100%.
got you. Got it now. Yeah. And that's what you, Councilman Overholzer was stating, right? Okay. Yeah, I got it now.
All right, any further discussion? All right, we have a motion and a second. Mr. Blair, would you call the roll?
Ms. Woods,
Aye.
Mr. Overholtzer,
Aye.
Ms. Park,
Aye.
Vice Mayor Arrowood.
Aye. Okay,
Thank you.
motion passes. Thank you. Okay. Now we move on to matters from the city manager.
Yes, thank you, Vice Mayor Arrowood. Just a few announcements. The summer reading program kicks off Monday through the library at the park bandstand. If it rains, which it might, I don't know. It's going to be in the library meeting room from 1 to 3 on Monday. The Hot Mamas will provide the music, all ages. So please sign up for a chance to win prizes donated by local businesses and individuals. Let's see. Also, there's another event this weekend on Saturday. The unveiling of the historic Queen Miller Home Virginia Highway marker will take place this Saturday, May 30th at 2624 West Beverly Street. There will be a gathering at noon with the actual program to begin at 1. A dessert reception will follow at Mount Zion Baptist Church on Augusta Street. And then finally, actually, I think that's it. That's all I have this evening.
Cliffhanger.
Sorry.
Okay.
That's all
All
I
right,
have
all
this
right.
evening.
Okay, now we can move on to matters from the public. This part of the city council's agenda is entitled Matters from the Public. It's time the council sets aside to hear from citizens and others about a wide variety of subjects. A copy of the Stanton City Council's Matters from the Public rules is available in paper form at the clerk's desk and online at the City of Stanton webpage. You are asked to familiarize yourself with those rules before commenting. Please come to the podium or raise your hand on the Zoom platform. Identify yourself and complete your remarks within 5 minutes. Okay.
Good evening, Vice Mayor and members of council. My name is Randolph Burton, 211 Hendron Avenue. I'm a member of the Lewis Creek Watershed Advisory Committee. And over the last couple of years, I've been working with some people in Friends of Middle River to attain benthic monitoring certification from the Isaac Walton League and Virginia SOS. And that's a program where you have volunteers, citizen scientists, so to speak, who get trained to learn how to identify, to collect and identify a wide variety of small insect larvae that live in streams and use that to assess the health of streams. So after getting certified, we put together a little team, and with the cooperation of the YMCA, we located a site on Lewis Creek alongside their new fields that they're developing. And so we went out and did a collection. And, you know, the benefit of this approach is unlike where you just sort of take water samples at a given moment, and test chemically, et cetera. These insect larvae live in the stream often for several years before they become mature and leave the stream and restart their life cycle back in the stream. So instead of just getting an instantaneous snapshot of what the water is at a moment, these insects respond to trends. So if things are happening over time, they can different bugs are more and less tolerant to different kinds of pollution. So you can start to understand a bit about the health of your stream and what's going on there. So anyway, we The results of our first monitoring sample are that, and this is again just downstream of town, is that we're sort of in a gray zone. It's not very healthy, but neither is it particularly impaired. So it was actually better score than I was anticipating. This is land that had been farmland for a long time with cattle that would often be in the stream, which causes lots of sediment problems, and that is one of the pollutants that affects some of these benthic macroinvertebrate larvae. So anyway, we do hope to establish another site upstream over time, and we'll have kind of an above town, below town, and a view over time. We have been, a number of organizations have been working with the Y to establish some stream restoration efforts on that property. They've been very enthusiastic and cooperative in putting in, we planted a bunch of trees earlier this year for riparian buffer. So we hope over time to see that stream health improve. So anyway, just letting you know that we're doing this to kind of keep an eye on how things are going in the environment. So thank you.
Thank you. Mr. Knight, do we have anyone with their hands raised?
We have no hands raised at this time.
Okay. Anyone else matters in the public? Ma'am, if you'd like to come up. Oh, Ms. King.
Good evening. My name is Susie King, and I'm from Staunton, Virginia, and I am the president of the African American Research Society. Birdie and I have come here as representative from our organization to say thank you for the grant that was given us. We have met our goal for now, and we hope to have an open house celebration, hopefully in 6 weeks, and we hope you can come out and see your money at work in your community. And we think that it's a historical landmark, and we are shining now. And the post office is very happy of what we have. And so this is a thank you to the city council. We know it's coming.
Thank you, Ms. King.
Thank you.
Mr. Knight, does anyone have their hand raised?
We have no hands raised on Zoom.
Okay. Yeah.
Hello, everyone. My name is Melissa Warner. I live at 101 Village Drive here in Staunton. I just wanted to take a few moments to discuss some frustration about the direction Staunton is heading. I actually relocated approximately 3 years ago from Dallas, but I grew up in Virginia, so coming home felt very special to me. However, it feels that every time a storefront opens, it becomes another vape shop or smoke store. And at this point, they are absolutely everywhere as you drive through our community. And honestly, I think many residents are asking the same thing. Do we really need another one? Because while these shops continue to multiply, some of the issues that people actually care about are being overlooked. For example, affordable housing. As a family of one, I have been searching here for over a year and a half, looking for affordable housing. I contribute to this community, and I still struggle to find something realistically affordable. 400, 500,000 is not realistic to someone who is shopping for one. Young professionals, working families, single parents, and even longtime residents are being priced out or forced to settle for housing that does not meet their needs, and I am one of those. So from a resident's perspective, it's frustrating watching more vape shops appear while basic needs like affordable housing continue to get harder to find. It feels like our priorities here in the town are backwards. Another issue residents notice every day is the increase in trash around parts of the city. There are areas that used to feel clean and welcoming that now have litter, abandoned belongings, and neglected public spaces. Staunton is a beautiful historic town, and people care deeply about keeping it that way. Cleanliness matters to me, community pride matters, tourism matters. And finally, I think that The city needs to invest more into safer bike-friendly infrastructure. Stanton has much potential to be a more walkable and bikeable community, but right now, many streets simply do not feel safe for cyclists and/or pedestrians. I know personally, I've taken up the hobby of leisure biking, and over the last year, I have felt unsafe doing so in my community. People want healthier, more connected ways to move around the city. We should feel comfortable riding bikes, walking downtown, and enjoying public spaces. And lastly, I just want to say I'm not here to criticize. I'm here because I care about the city in which I chose to call home, and I know many other residents do too. So thank you so much.
Thank you. Mr. Knight, do we have your hand raised?
We have no hands raised.
Any other items, public? Okay. That's right.
Everyone, my name is John Baber. I live in Stanton. I'm the Commonwealth's attorney. Just felt like a time to come and advise the thousands of people watching this online, and to the people online, the definite hundreds of people in this room, to lock your car doors. I know that sounds kind of silly. I dealt with two very serious cases today where 40, 50, 60 people had things taken from their cars, including a number of firearms, all from unlocked car doors in the city of Staunton. One individual came here from Charlottesville. The other one grew up here. They're teenagers. And you'll see something in the news leader, at least about one of the cases, but it really is that simple. And I just wanted to say it to everybody. It literally is unlocked car doors. And the cases leave everybody feeling unsafe in the community, there's something kind of very violating about someone on your property at night creeping around your stuff that makes everyone feel unsafe. But I'll tell you that an unlocked car door cues somebody in that the neighbors will have unlocked car doors or unlocked back doors. They're an attractive nuisance, so to speak. So if you leave your car door unlocked, you're making it more likely that your neighbor's car will get broken into as well. So it felt like a time, because like I said, I dealt with two of these cases today that caused a lot of problems and thousands of dollars in restitution that may or may not get paid. To just remind everybody, please lock your car doors. Sometimes the simplest advice is the best advice. Someone told me a long time ago, if you don't lock it, you don't want it. I thought that was kind of a funny saying, but if you don't lock it, you don't want it. So I know it's small towny and it's kind of sweet, and Stanton's a really great place, and the whole idea of the unlocked door kind of is something we all strive for, but I'd say let's make that more of like an emotional goal than a physical one. There's nothing wrong with a locked door. So with that, thanks for letting me speak.
Thank you. Mr. Knight, do we have anyone?
We have no hands raised.
Okay. Anyone else from? Okay.
Aaron Varmer, Staunton, Virginia. I wasn't gonna say nothing, but this is like the second city meeting I've been to in as many weeks where I hear people complaining that they got their guns stolen out their car because I don't know, maybe they had their car unlocked with their gun in their car. Now, I'm not a gun owner. Things are expensive. I'm multiply disabled. My hands shake. And if you made me angry, I wouldn't want to be responsible and have an overzealous prosecutor, make any sudden moves in the courtroom. Point is, I thought gun owners had responsibility to secure their firearms. Seems to me like Commonwealth's attorney getting up here being all shucks might want to advise some of these gun owners. There might be a ticket coming or something. Ain't that right, Mr. Baber, back there on your phone? Why don't you do some education from the podium about what these gun owners should be doing? How about that?
Good night. Any,
We have no hands raised.
hey, anyone else from the audience? Going once? Okay. I hereby declare this meeting adjourned.